Beautiful. Hello, everybody. We're going to talk this afternoon about biocognitive contemplative techniques. And coming into our chat today, Dr. Martinez didn't know the topic or the focus of what we're doing. So anybody that jumps on, please feel free to add questions to what I'm going to be sharing. But I find that in workshops and different lessons in biocognition, lots and lots of people want more techniques. And I think there's a value in understanding how to develop your own techniques or develop your own contemplative practice. So the first question to start the conversation today, what is meditation? And are there different forms of it? What is meditation?
You were very tricky. You didn't prep me for this. I'm going to have to be spontaneous and extemporaneous, but that's good. Okay, what is meditation? There are many, many types of meditation, but basically there are two genders that you could actually divide it into. One is the Buddhists talk about samatha, which is a meditation on focusing. You could focus on an image, a mantra, anything that brings the mind together, to quiet the mind, and to give it focus. That's one type. But that's not all you can do, because that will quiet the mind, but it really won't give you much insights. So there's another one that's called vipassana, and there are many methods, but the second one is what's called analytic meditation, where you actually ponder on a particular subject, love, but not intellectually, just allow it to expand and to express. That's the other. In biocognitive psychology, we have another method that is a contemplative method that actually uses the best of the two, plus some neuropsychological knowledge that we have from Western science.
Okay, so the next question you're starting to get into already is, what's the difference between biocognitive contemplative techniques and other forms of meditation?
Well, the contemplative, the conventional contemplative is an observation without any type of judgment. It's the observer watching the observation. That's really very good. But I use the biocognitive method to actually make changes. So therapeutically or clinically to make changes and special development of the individual. And there we go from the relaxation to the contemplation and then to what I call the theater of change. And when you get to the theater of change, that's when your mind is most open to learn new methods and to create new neural maps of behaviors that you're trying to implement or behaviors that you're trying to get rid of. So I call it theater of change because we basically create our reality. We're the directors and the script writers of our reality, and we project everything of ourselves into our reality. So in that theater, you begin to change the script, change the characters, and change the directorship that you've given. But it's at a level where it's a theta waves or something close to theta waves, where the person is much more open to information, to assimilate it, and also to make changes in the context. So it's not an intellectual process, it's an embodied process of changing based on how you deal with the context and how you deal with the scripts that you have from your life.
Sometimes I've heard you talk about the theater of change as embodiment. So you just brought that word up. As you're going through the phases of a contemplative technique in biocognition, what is embodiment? What does it feel like? How do we know that the technique is working for us?
Embodiment is the felt meaning of an experience. So if I tell you I'm going to hit you over the head with a bat, that's an intention that has no embodiment. You can either embody the sensation that you think you're going to feel, and that's embodiment of the anticipation, or you wait till you get hit over the head and then you have a felt meaning of what it feels like and what is the experience of getting hit over the head. So knowing that, neuropsychologically, embodying, enacting and embodying is really the way to make lasting change. But you have new neural maps that need to be nourished by repetition and by recontextualizing meaning. So the embodiment is the taking it out of the intellectual and putting it into the mind-body sensation, experience, and sensing of the meaning that you're wanting to give the experience.
I hear a lot of people when they get super stressed out or they're overwhelmed and moving too quickly through their day make comments like, I could sure use a meditation, or I wish I had some Zen right now. So, what's the importance of developing a personal meditative practice? And how does someone begin? What's the first step to even understand how you do that for yourself?
The most important thing to remember is that, let's go back to neuropsychology. In neuropsychology, or uh, the nervous study of the brain, or the neuroscience of the brain, something called the default mode. And the default mode of the brain is when everything settles and everything's back to the usual. You go into the default mode. And the default mode is the way to look at it is the goggles that you use to look at the world. So if you do a meditation or a relaxation, you can get relaxed and you can get contemplative, and it'll be really good. But if you don't change the default mode, then within a few minutes, the meditation is gone and you go back into the hyper alertness or hypervigilance or whatever it is that you view the world with, whatever map you look at the views of the world. So in biocognition, we're very aware of that. And what we try to do is not only go into relaxation, contemplation, but also change the default mode so you can look at the world differently and you can have a selective perception of what you're going to be looking for in the world. Selective perception means that if you have an expectation, you begin to look for evidence about the expectation. So if you have a thought that you're going to have a good day and you prepare a good day, then you'll be more prone to looking at what's happening to support the good day, or vice versa. So really the theater of change is where you go to make the modifications of the default mode.
And what's step one for somebody who really wants to develop their own practice instead of relying on apps or relying on books or somebody else to deliver meditation for them? How does someone actually begin?
To take my experiential courses is one way, because I teach it there. But here, I'm going to give you some specific ideas that you can develop. And first is you have to find a quiet place. You have to do it when you know that you're not going to get up and go to work. It has to be when you have time after you finish the meditation or the contemplation, so you can let the system absorb the experience. You also do it in a place where you can reduce the noise and you can feel the safety. And the mind-body code for safety is that you have to do it with your back against something solid or a chair that's solid, because we have epigenetically learned that if you have your back to the cave, you could have an animal or an enemy hurt you. So that's already built epigenetically. So you have to find the solidness behind you. You also have to feel the support, which is another mind-body code for safety, and that is feeling the support of you on the chair or on the floor to ground yourself and enact that grounding before you even try to do any of the meditation. And the next thing is to pay attention to your breathing. You don't try to change it. You observe what's going on. And by doing that, you let the body then regulate itself to what would be considered the normal breathing for you. So there's no technique in that sense. It's more paying attention to the 150,000 years that you have of Homo sapien trial and error. And then you do the different kinds of meditations that are taught, whether it's focused meditation or analytic meditation or biocognitive contemplation. That's a basic understanding of it, and just to have a grounding of what you can do.
Another question that I hear people ask a lot lately is about moving meditation. So you talked about finding a quiet place where you can be still, but what is moving meditation? Is that a thing, or is that something that in our culture today is just another one of those cool buzzwords that's fun to talk about in our own practice?
If it's done right, it's really very good. And again, I'm going back to neuropsychology because that's what I am, a neuropsychologist, but I think it gives it a really good foundation. We know that we orient ourselves in time and space with what's called the proprioception of our body. It tells us we're in time and space and moving from one place to the other. And then we have procedural learning, which is the repetition of things that are not intellectual, but it's a mind-body process, like learning to ride a bike. You don't ride a bike by saying, okay, I'm going to move to the right and then I'm going to move to the left. There's a procedural process that you don't know what's going on, but you know at some point you find balance. Those two things are important. Then when the body is in movement, the brain pays attention to the movement rather than sitting. Sitting, you just have to pay attention to what you're sitting. But when you're moving, it increases the curiosity. It increases the ability to absorb. So any kind of movement that you do in a meditative walk, for example, a Zen walk, where you do very slow pacing to the point where you're a little bit out of balance, the brain pays much attention to that. And then you bring an intention in, and then you do the Zen walk. And gradually what you're doing is you're orienting in time and space, and you're also creating a procedural process to assimilate the information. And the reason for that is that we learn all our senses from movement. When we're children or when we're newborns, everything, the learning happens is through the movement. So one experiment was done with cats. They had newborn cats. Some were allowed to move, and they were carrying a little carriage in the back where they had other cats, and they were walking around in a circle, and the cats could see everything, both the ones that were walking and the ones that were watching. And they let them do that for a week or so, and after a while, they let them free. The one that was moving the cart moved normally and could see everything. The ones who were just watching the world without movement started walking around as if they were blind. So movement and sensory is very important. So that's why Aristotle was so wise. He had these peripatetic walks that he called them. He would take his students on walks to get information, and Steve Jobs would also do that. I don't know if he thought about it with Aristotle, but Steve Jobs was quite bright.
Thank you for this information today. For more of the contemplative forest walks, you can go to the link that will drop in the description of this video. And in the next few weeks, May 3rd, you're doing a workshop called The Wounded Hero, or starting a series called The Wounded Hero. So if anyone is interested in going deeper into their own personal practice or getting the first taste of what biocognition is all about, can you tell us just a little bit about that workshop and what it's going to, what we would experience as a participant?
Yes, that workshop will be a group dynamics, which will be actually interacting. But although I'm a licensed clinical psychologist, it's not going to be doctor-patient, but student-teacher, and not pathology and not giving labels, but actually helping people come out of wherever they are and move forward using archetypes. Some of the Jungian archetypes of the wounded hero is an archetype that happens in every culture. And it has a narrative, it has a story. And rather than being victims, we're not victims, we're wounded heroes on our journey when we get wounded emotionally or physically or whatever. And then it'll be a way of, and the group is small, it's only 12 to 15 people. And if it goes up to 15, then we get a new group, so we can keep the group dynamics going. And I'm going to be using some Gestalt therapy techniques as well as biocognitive techniques to actually make some changes quickly, but not quick fixes. Quick fixes lead to quick disillusionment. This will be work. Sometimes people say, well, your work is complicated. Well, life is complicated. But you don't have to be in therapy for 10 years to do that. It's quick, but it's complex. And complex doesn't mean that you're not going to be able to understand it. It means you're going to have to invest in what you're doing, and then lasting change happens.
Very good. Thank you so much. And like I said, we'll put the links in the description of this video. And until we meet again, thank you, everybody.
Thank you, Samantha.